Well, early and unintended pregnancy is a global public health concern driven by multiple factors, including poverty, cultural norms, peer pressure, and sexual abuse, among other adverse consequences for adolescent girls. Aged between 12 and 19 is then an increased rate of school dropouts and poor school performance, perpetuating the poverty cycle even further.
Approximately 12 million girls between 15 and 19 give birth each year in developing regions, according to the World Health Organization global statistics. Complications during pregnancy and childbirth are the leading cause of death for 15 to 19-year-old girls globally too. The Let's Talk campaign on early and unintended pregnancy was launched last year to try to reduce these pregnancies in the eastern and southern African region.
On the catch-up this week, we chat to Ntiyiso Shingwenyana, Senior Program Manager at the Save the Children International, to chat about the progress made amid the global COVID-19 pandemic. A very good morning to you. Thank you very much for joining us, Ntiyiso. I just want to start off by looking at some of the current definitions that have been put forth to define the magnitude of the global concern that is early and unintended pregnancies in an Eastern and Southern African context. Walk us through what that picture looks like to date.
Hi, good morning to you and good morning to your viewers. Thank you for having me on your program. In terms of looking at the magnitude of the child pregnancy problem, worldwide, on a year-on-year basis, we've got about 21 million children falling pregnant. And when we come closer to home and look at Southern Africa, we're looking at about 5 million children getting pregnant every year. And just to contextualize the problem in terms of Southern Africa, the children that fall pregnant within Southern Africa, almost half of that pregnancy occurs within the confines of marriages, and some of those marriages are marriages that have actually been arranged by the guardians or the parents of the children. So that's how the situation looks within Southern Africa. Now, the issues that are looked as predisposing factors for children's pregnancy are multitude, but education of parents is one of the key factors that influences children falling pregnant.
So you speak about education, of course, being a driving factor or lack thereof amongst teenagers. But I also want to look at some of the drivers and determinants of early and unintended pregnancy related to cultural norms and practices, and even the influence of male counterparts in that matter.
That's perfectly correct. We are looking at education as the first driver, but we're also looking at the area from which the children are coming from. There are studies that confirm that the rural children are more likely to fall pregnant as compared to their urban counterparts. There is also the issue around just knowledge about sexuality by the children themselves. There's a huge knowledge gap in terms of reach of sexuality education by the children themselves. The other issues that we can look at as predisposing factors may lie at policy and service provision level. At policy level, there are quite a lot of policy gaps that can actually inadvertently promote children to fall pregnant. In terms of education, we have in the East and Southern Africa, most countries adopting comprehensive sexuality education. In spite of that, we still have implementation of comprehensive sexuality education being spurious and not uniform. Teachers are not adequately capacitated to deliver comprehensive sexuality education. And in some instances, we find countries where the comprehensive sexuality education being examinable and mandatory, in some countries it becomes a choice. So those disparities are actually promotive. Even though the policy is there, it is difficult to carry through and be effective with the prevention methods. At provider level, we know that there are various consent age group and age limits for access to health services in particular. For children to be able to access contraception, which is closely associated with children's pregnancy, or even prevention education at health facilities. There are various age limits that are imposed. South Africa, together with Malawi, we've got the age limit being 12. But in other Southern Africa, you've got as high as 18 being the limit at which the child can go and access sexual and reproductive health services.
Ntiyiso, you spoke about the knowledge gaps as well as the policy gaps that exist currently related to the issue of early and unintended pregnancies. But I also just want to look at the psychosocial effects of what this means for the future of the population, and also how this perpetuates the cycle of poverty intergenerationally. Walk us through what's been observed on that front.
In terms of social aspect, let's probably frame that mostly around poverty as one of the drivers, and probably move outwards to expatiate from that point on. We have a lot of African children living under conditions of poverty, and that takes away the urgency to negotiate life spaces that are protective for the children and put children in vulnerable positions. And the direct result of that is we see children, not by choice, but out of necessity, engaging in intergenerational sex, in transactional sex, and within those contexts, it is still difficult for children to negotiate protected sex in those spaces, and that becomes one of the social drivers that promote child pregnancy or early unintended pregnancies. We're also looking at the influence of the social structure. Recently and at the current moment, we have children that have access to quite a lot of information, quite a lot of display of virtual lifestyles that are not necessarily a reality through social media.
My quick question,
yes.
I would like to ask about the Let's Talk campaign. How has that played a role in helping to educate the young ones about the issues that they're facing? I believe it was rolled out late last year. How's it been doing?
Hello?
Ntiyiso, I'd like to ask about the Let's Talk campaign. How has that been doing since it's been rolled out?
Okay, let me quickly speak about the Let's Talk campaign. I know I've got colleagues that are more close to the campaign within Save the Children that have been instrumental in the launch of the campaign. This campaign is a brainchild of UNESCO, a United Nations agency. It's also the brainchild of Save the Children Sweden, and those that are located within the Eastern Southern Africa regional hub. Now, after launching the campaign last year, there have been quite a lot of follow-up actions that have been undertaken, and since then, let me speak to what is now in place. The campaign is running successfully. It has actually attracted participation of faith leaders. It has attracted participation of traditional leaders. It has attracted also participation of the civil society organizations. It has attracted participation of international NGOs. It has also attracted participation of government structures, and it is having a very close relationship with the South African National AIDS Council, and situating it alongside the South African National AIDS Council brings to the table participation of the men's sector, which is one question that was asked earlier by one of the interviewers, like how are men contributing to this huge campaign and prevention of early and unintended pregnancies. So with the participation of SANEC and the men's sector, participation of Sonke Gender Justice, and other relevant organizations.
Ntiyiso Shingwenyana, Senior Program Manager for Save the Children International, of course, just chatting to us about early and unintended pregnancy being a global public health concern.